afternoon, everybody. We're going to get started with our afternoon session in this room. So on behalf of the Collaborative Research Center for American Indian Health, I'm very pleased to introduce our next two speakers. Both of them will speak on the very important topic of tribal research, data return, storage, and analysis. We have two of my colleagues presenting from the methodology core within the Collaborative Research Center for American Indian Health. Puumala, Dr. Susan Puumala, is an associate scientist in the Center for Health Outcomes and Prevention Research at Sanford Research in Sioux Falls. She is currently the director of the methodology core, as I mentioned, for the Collaborative Research Center for American Indian Health. She's also an associate professor in the Department of Pediatrics and the Department of Internal Medicine at Sanford School of Medicine at the University of South Dakota. Dr. Puumala earned her PhD in epidemiology at the University of Minnesota and a master's in science and statistics from Iowa State University. Dr. Puumala has worked in clinical and population health research, both conducting her own research and assisting others in the study design and methodology for 14 years. I know a lot of people at Sanford Research definitely take advantage of Dr. Puumala's skills and have her quite busy assisting with other projects. Dr. Puumala's research interests involve reproductive, perinatal, and pediatric epidemiology with an emphasis on maternal exposures in pediatric disease and health disparities. And I'd also like to introduce Mr. Chad Birger. He is a senior methodology analyst at Sanford Research in Sioux Falls, South Dakota. He primarily works with the methodology core of the center under Dr. Puumala's direction. And his work involves assisting tribal partners and researchers with data management and analysis. He also works on training development for our CRCAIH partners, on spreadsheets, databases, analysis software, and that's just some of what he does. Now, prior to joining Sanford, Mr. Birger spent 10 years as an assistant professor and instructor of mathematics and computer science at the University of Sioux Falls. He has a Bachelor of Science degree in Mathematics and Computer Science from the University of Sioux Falls and a Master of Science degree in Mathematics from South Dakota State University. Welcome, Susan. I will let you.
All right. I'm going to try to adjust the microphone because I'm a very quiet talker and I apparently need to stand very close to it. So thanks to Mana for that introduction, and I'm glad to talk to you today about basically tribal research data. And when Chad and I started thinking about this, we started thinking about all of the different components that were associated with that. So our end idea was secondary use, and so then we worked backwards from that to think about what needed to be in place for that to happen. All right, so today we have a couple of different objectives. The first way is to think about acquiring data from researchers to store it in a way that promotes secondary use. And then the second one is just to think about if you have your data, if it's stored in a way that you can use it, how can you use it and what would that look like? So the concept that we're thinking about today is really talking about data stewardship. So not just owning the data and archiving that data, but actually taking care of that data and ensuring its preservation over time. I wanted to give you just a little bit of a motivation for why this is important. And so one of the things that's really important is there's national data, there's regional data, but the only really good source of local data is probably within the tribes themselves and within the data from the research studies that have been conducted. And so that's one really great advantage to having the data from those research studies is that's a great source of local data. And so then you can, the good thing about having local data is you have very specific information, like for submitting grant proposals, for thinking about how you could overlay data from different studies and how you could really mold that data to thinking about what's important for the tribe. Okay, so we're going to go over 3 things, as I mentioned today. One is obtaining accessible data. So Chad's going to talk a little bit about ways and methods that you can help ensure that the data that you're getting is returned in the best possible way. He's also going to talk about best practices for actually storing that data. And then I'm going to go come back in and talk a little bit about uses for that data. Oops. So now I'll turn it over to Chad.
Thank you very much, Susan. Thank you all for being here today. So before I get started on data return, I wanted to quickly cover some data terminology just so that when I say a few things, we're all on the same page. So one of the things that I notice very frequently is data is an all-encompassing word. We say data to mean a lot of different things. Some of the examples of things that are utilized or used, referred to when the term data is used, include laboratory notebooks, which in a scientific laboratory setting sometimes are used to document procedures and figures. Completed surveys are also used as for the term data. Summarized tables and statistics. Research findings or published findings, things that come out as a result of a research study, sometimes are referred to as data. Laboratory specimens are also considered to be data. And the one that I usually pops into my mind first is what I call raw data, or actual facts and figures, values that come straight out of a data set. And so all these things kind of fall under the umbrella of what data is. The NIH defines final research data as recorded factual material commonly accepted in the scientific community as necessary to document and support research findings. This does not mean summary statistics or tables, or what we refer to as aggregated data. Rather, it means the data on which those summary statistics and tables are based. So the NIH is kind of leaning more towards defining this research data, final research data, as what is used to generate the published reports and the summary statistics and tables, the aggregated results, as opposed to the output themselves. So if you want to think of a research project, it can have a whole bunch of different information underneath of it. It can have the research data, which consists of those actual values themselves that are come out of the research study. They can be taken from a lot of different things. The aggregate data, which are the summarized values, and a lot of times those can be also put into other things. And then there's an other category as well, which describes many of the other things that we saw on that first bullet point list that I showed, as well as basically a whole bunch of other things there as well. So that's why I just kind of called it other. One of the things to keep in mind with tribal research data is data stewardship, as Susan mentioned earlier. With tribal research data, data stewardship refers to the responsibility for taking care of the data. And that means that we need to ensure that the quality of whatever data is stored is very accurate, very, very good. And so some ways that we can help with this are defining what is going to be done with data if it's going to be returned, and who's going to be responsible for collecting, storing, and analyzing that data. Those are good practices to document along the way. We had heard earlier about cataloging research studies, and cataloging research studies is very important to keep information about specific studies. Sometimes I refer to this as metadata, information about the studies themselves. But some things that can be cataloged with regard to research studies include principal investigator, subjects and keywords, relevant IRB forms and protocols, any dates, other relevant information could also be included there. But usually cataloging does not involve collecting the research data itself. So cataloging is more gathering information about the study, not about the data. So one of the questions that we get asked pretty frequently in the methodology core is, should we collect research data? And so there's some kind of prompts up here, some discussion prompts for some questions that tribals members should ask if they're going to look at collecting research data. The first one is, what data should be returned? If you go to an investigator and say, give me your data, what does that mean? Okay, so make sure you're very specific on what data you want to be returned. Where's the data going to be stored? And so that's kind of our second thing we're going to talk about today is data storage. And then what's going to be done with that data? And so that's hopefully what Dr. Puumala will get to here towards the end with some secondary data analysis. A little bit more terminology. I had mentioned the term raw data earlier. I'm going to go ahead and define that right now. Raw or primary data is data that's been collected from a source but has not been subjected to processing or any other manipulation. Something similar to raw data is de-identified data, which is data that's been processed to prevent a person's identity from being connected to that information. And de-identified data is very good because it can be utilized after the fact usually without any type of IRB review, and so Susan will talk about that later on as well. So how should data be stored? Well, the primary method for storing data is in a database. And so I have some diagrams up here to describe a very basic database in which data is organized into rows and columns. A row is something that I refer to as a record in a database, and it stores information about an individual or subject for that particular research study. A column, or a field, is an attribute or variable that's being collected for each person or subject in that research study. And so here you can see some examples. I have 6 different columns on here. Each one represents a variable that's collected. And then I have 2 rows. Each one of those represents a unique individual. So now that we have a basic understanding of the terminology, the next thing we're going to look at is data return. So why is data return important? There's some very important benefits for data return. One of them is that it can be utilized for tribal research. So if the tribe has information that they want to look at, go ahead and gather that information from the researchers and it will be available to utilize. It's also very important because it's a great educational tool and it was utilized to benefit the tribe, and so it's always good to keep that data on hand. As I mentioned earlier, it's very important to inform researchers early in the process if you want to get their information. And one of the things that you should tell them is what information should be returned. Don't go to a researcher once again and say, give me your data. That could mean a lot of different things to a lot of different people. And so maybe setting up a checklist for what exactly you're looking for, having definitions would be good. What format should it be returned in? How is it going to be useful to the tribe later on? If it's returned to you using in some statistical software that costs thousands of dollars, is that really useful data? So keep that in mind when you're asking for information. And when should it be returned? Should it be returned upon completion of the study, so on and so forth? So that's just a question, and that's probably more of an IRB type question, so something to kind of tie into the review board process. So here's a data return flowchart that I created. And on the screen, you can kind of see that we have a tribal research office as one entity and a principal investigator for a research study listed as another entity. The process should go that the tribal research office, upon the designated time, should send a request for data return to the principal investigator, and then the principal investigator can then return that data. Okay? Usually describing that format is very useful as well. How do you want it returned? And so then it should go back to the tribal research office. But then, in order to make that useful, the tribal research office should verify that the data was returned in a usable and correct format. If it's not, some type of letter or document should be created to send back to the principal investigator so that correct data can be returned. If it is, then it should be stored according to the documented data storage process. So I'll give a quick success story with one of the tribal partners that we worked with on data return. This specific tribal partner did create a data return form. It was approved by all parties that needed to approve it. And it's sent to researchers upon completion of the study. It requests items be returned on a single flash drive. Hopefully that flash drive can store all of the information for the study. We haven't come across a case yet where there wasn't a flash drive available to not store that, but if there was, then maybe setting up a procedure to handle that. And within that flash drive, there are actually 3 separate folders to kind of organize the information so that when it comes back to the tribal research office, it's easier to deal with. So one of the first folder is a data folder, which contains subfolders for the actual data, and the data was requested in a universal format as well as any software-specific format. It also should contain a subfolder containing asking for a code book and any instruments that were used in that data collection. The other 2 folders were requested, asked for grant and relevant IRB forms and newsletter and other dissemination of result findings. And so those were just included in other folders so that they didn't have to be sought after later. So I'm going to talk a little bit about the data folder. In the data folder, different tribal partners can ask for whatever they want. In the specific success case that we worked with, we asked for de-identified data, or we determined that de-identified data in a universal format was the appropriate way to go. When I say universal format, I'm referring to like a database that's not software or platform dependent. So something that would be software or platform dependent would be like software specific, like SAS or SPSS files. Those do require usually that you have some type of expensive software to open them. If you have the platform independent universal format, like a TXT, usually they're tab delimited, or a CSV, comma separated values file, those can be opened in any computer, any operating system. So those are relatively universal. The codebook and instrument folder I talked a little bit about earlier. A codebook is a descriptive file that describes the variables in the data set. And when we said instrument, a lot of the studies that we were looking at were utilizing survey instruments. And so to be able to interpret the data later on, maybe having an actual blank copy of the survey that was administered just for clarity of which questions were actually asked to gather that data, we also thought was very important. So the next item I'm going to talk about is data storage. With data storage, some key concepts that I want to go over are data access, security, location, and procedures. And with location, we'll talk about cloud, server, and local storage in a little bit here. And then procedures, one of the key things that I think is very important. How do we set up file naming conventions and backup and recovery? Those are very, very important. So with data access, the first topic that we're going to talk about with data storage, some best practices of data access should be that data should be stored so that it can be accessed, but access should be limited. Okay? However, I recommend that more than one person have access to that data. The scenario I always use, it was a terrible movie several years ago, but it was the hit by the bus scenario. It was one of those Final Destination movies. They were awful. But basically, if you have one person that has access to that information, and that person steps out in the street and gets hit by a bus, like on that awful movie, then who then has access to that information? So setting up a procedure or process for multiple people to have access to the information is very important. The next thing to talk about is security. Without a doubt, data should be password protected. Most of what we do involves logging into computers with some passwords, and that usually is somewhat secure. However, I recommend storing your passwords in a secure location. You'd be amazed with how many times I walk into colleagues' cubicles or offices and I see their passwords on sticky notes on the bottom of their monitor. So make sure that those passwords are in a nice, secure location. When disseminating passwords, make sure that you do not email those passwords to one another, because email is not secure. Even if you're emailing to someone in your own organization, it may still go out and about and have prying eyes on that. So I would recommend not emailing passwords at any point. Also, some basic security measures. Make sure you have a firewall and antivirus software on your computer to prevent against cyber attacks, and restrict access to the computer, services, or locations that contain that data. Don't store information on a computer that anyone from the public can come in and log into. That's just very, very basic, just so that something doesn't happen, or some type of malware, malicious software doesn't get put onto that computer. The next item is location. With location, I did mention earlier cloud server versus local storage. The cloud is one of the most misunderstood or latest buzzwords for computing. The cloud is basically just a large server someplace else, and you upload and download information to that server via the internet. So that's basically what we discuss when we talk about the cloud. Some external company maintains that server, and the data is usually stored on there for a monthly fee. And the companies have things set up based on a lot of different variables, but I can talk about those later on if you have questions about specific cloud services that are available. A server is a little bit different than the cloud, because a server is actually located usually on site or within your company. An IT department usually maintains that. And if you sit down and you have to log into your computer, log into like a domain, you probably are logging into a server. And so that's usually what that's referring to. The local storage is utilizing things like flash drives, hard drives, CDs, DVDs. There's probably 1,000 other things. They don't make floppy disks anymore, but that would be another good example of some local storage. And so what I did is I put together a little list of some advantages and disadvantages of utilizing each one of those types of storage locations. So like with a cloud, advantage, it's very easy to use, and the backup and recovery is covered by the service. However, a disadvantage is that it's not local, it's not on site, and they do have monthly service fees associated with those services. With a server, some advantages are that they're locally run by trusted professionals, and backup and recovery is usually the responsibility of the IT department. Some disadvantages is that an IT department is needed to support and maintain the servers, and equipment is expensive to purchase and maintain, and not just the servers themselves, but a lot of them have to be stored in separate server rooms with dedicated HVAC systems and fire extinguisher systems and things like that. So there's a lot of expensive equipment associated with that. Local storage also has advantages. The data is very accessible, and it's stored locally, obviously. However, some disadvantages, disks can be corrupted, and backup takes a lot of time. And so I'll get to backup a little bit in my procedures, but the first procedure that I'm going to discuss is file naming. So how many times have each of us logged into some type of server and we've tried to find a file that someone else has created? It's very, very difficult to do that sometimes, because we all have our own filing scheme. If we want to have a universal data storage technique, there should be some type of easy to find and use availability for that data. So I recommend setting up a naming convention that's well documented and easy to follow, and everyone does follow that has access to the data. So if someone stores information in there, they utilize that file naming scheme. So if someone else needs to access that data 2 years from now or 6 months from now, they can easily find that information. It's not just document 27 or spreadsheet 54. It has a very descriptive file name. The last procedure I'm going to cover is backup and recovery. with backup and recovery, I recommend setting a schedule and sticking to it. If you miss one backup, you're going to have data loss probably. The plan should be documented, and some things that it's dependent on are the data storage location. If you're utilizing one that already has a procedure in place, that's great. They probably already have their documentation. Personnel is also a key issue. If it takes hours to run, take that into consideration, and equipment as well. And I also recommend testing that recovery procedure frequently, because until you actually need it, it's nice to know that it works. So that's another very important step in the process. So if you have questions about data storage or data return, I'll be happy to entertain those after Dr. Puumala talks to us about secondary data analysis.
So thanks, Chad, for walking us through some of those technical details, thinking about really storing and preserving your data for future use. Before I go in, I'll go into a little bit of a tangent on why I like secondary data. So in my career, I've spent a lot of time collecting primary data. I've spent a lot of time on the phone talking to participants. Recently, I've spent some late nights in the emergency room talking to parents. And the downside is that it takes a lot of time, it takes a lot of effort to do that data. I've also done a lot of studies with secondary data, using national data, combining data from various sources. And it's nice. You do not have to, you don't actually have to talk to people, which is an advantage for an introverted researcher. So that's a great benefit. So I'll go through a little bit of the technical details about using data for secondary use, and then give you hopefully some examples to get you started thinking about how you might use some of the data that might be available to you. Okay, so I'm going to go through, first of all, what data can be used, what are some of the things that you need to think about when you decide you want to use some secondary research data. And then we'll talk about some possible uses. Okay, so potentially any data from any research study can be used for secondary purposes. Most people are familiar with using aggregated data for purposes, things from manuscripts, reports, things like that. You can just take that information. You don't need any approvals. You usually need to cite where the data came from. But you can just use it. It's ready-made, and it gives you information that you can use. But if you want to use the data in a little bit more detailed and more sophisticated way, using that individual person data, then you need some additional consideration. So one of the things for research studies is you really have to think about what did that individual originally consent to. So you want to make sure that any way that you use the data is consistent with that initial consent. If it's not, it's still possible that you may be able to use the data, but you're going to have to go back to those individuals to make sure that they're okay with using that data for a purpose that they didn't consent to originally. So that's one of the biggest considerations is it's important to know what was consented and what the participants actually agreed to. So it's most helpful if you can start this process at the beginning of a research project. So if you're thinking about, like for a tribal research department, if you're thinking about using the data for other purposes, to really have those conversations with the investigators doing the research before it takes place, so you can see what's being consented to and how that might fit in with other possible uses for the data that you're going to have. So you might think about like a data sharing ownership plan, and then thinking about what wording you might like to see on consent forms that researchers create. The next thing that you need to think about for secondary data usage is really going through the different approval process. As a research study, it was approved by different review boards or different committees. And so you need to think about who originally approved that study, and do I need to go back to them to seek approval to do this analysis that I want to do. So it depends on whether or not you can identify the individuals within that data. And then it also depends on, again, what was set up at the beginning of the research. What was the data ownership, data sharing plan? And then what's the tribal research policy? So if we're talking about tribally owned data, what's the policy for reusing that data? Okay, so if it's de-identified, it makes things a little bit easier. According to the Office for Humans Research Protections, If it's de-identified, it's no longer human subjects. So you may not have to have as many approvals for that particular study. But you want to make sure that whatever use is consistent with the tribal research approval. So you may need to go back to the Tribal Research Board to have that approved. If the data is identified, it usually means that the study is still going on. So you have that other level of oversight into the study. So for that type of data, you will likely need to go back to all of the original places that approved that data to begin with to make sure that they're okay with the secondary use of that specific identifiable data. And you would almost certainly need tribal research approval if the data was identified. Okay, so if you have the data, you know that what you want to do is consistent with the original consent form, and you know who you need to seek approval from to use that data. But you don't know what's available. That's a problem. So one of the things that CRCAIH has done through the Regulatory Knowledge Core is really kind of try to help our tribal partners think about how you can figure out what research has been done, how you can maintain a record of that, so that you know what data might be available if you want to reuse it. Another great possibility is thinking about data repositories. And there's a lot of talk about instituting these sorts of repositories so that there's more of a streamlined process for the secondary use of that data. I don't know if, well, there's a lot of different ones that are available now, and I know some of our tribal partners are thinking about that and trying to implement some of those policies to have that really broader access to data. Okay, so now I'll get to just some examples to kind of give you a flavor and get you thinking about using previously done research data for broader knowledge. So the first thing is aggregate data. So probably everybody knows how to use aggregate data. But you can use them at the community level, just thinking about disease prevalence, risk factors, things like that. And then one of the things that came up in one of the research projects that I was doing is I presented some data back to a community on some focus group data where we talked about healthcare use for kids in their community, and they were doing a community assessment at the time. And so I suggested that they could use some of our data if they were interested in that as part of their community assessment. So what's going on in our community? And at that point it was pretty much aggregated data, so they could go ahead and take that and use that without any additional approvals. Grant proposals are another great use of aggregate data, just again to give you very area-specific information about what's going on in a community and what's the state of affairs for a particular health problem. And individual data, that gets a little bit more exciting and a little bit more interesting about the different things that you can do. One of the things that I like to think about a lot is how you can take data from a number of different sources and just think about what the implications of that are. So if you have, well, one concrete example is when I was in my PhD program, I worked with childhood cancer incidents. And so we were able to combine data from birth registries and cancer registries and kind of overlay that data. And we were able to overlay that with some mapping data to get a better picture of what was going on overall. You can do longitudinal analysis, so thinking about what's going on over time, maybe laying that over, you could lay it over environmental data or disease prevalence data or risk behavior data, just to get a richer, more fuller picture of what's going on in a community. And the other thing is you can combine that. So say you have some information that's previous use data. An example in one of my studies, I used a multitude of different data to get a whole picture of what was going on. And so we used some existing data from medical records, and then we combined that with other data that we collected ourselves from focus groups and from other surveys. So really trying to get a broader, more richer understanding of what's going on. So when you think about the secondary use data, that really has an important piece that you don't have to collect yourself, that you can use. All right, so overall, hopefully we've talked a little bit today about data stewardship, how you can get your data back, how you can preserve that data, and then some thoughts and ideas about how you could potentially use that data. If you have any questions or want any specific advice on any of the technical details, you can contact me or any member of the methodology core. I kind of listed us all there. If you want to talk directly about data use or data storage, you can find Chad or me at the meeting. Wyatt Pickner is also a member of the core that's here, so feel free to come up to us and talk to us about your data, or send us an email or call us later on. So thanks.